Hello everyone, welcome to the InnoHealth Conference 2024. My name is Marcelina, your host for today's InnoHealth Magazine podcast, and today we have an honor of having Mr. Arun Agarwal over here.
Thank you.
So a very warm welcome, sir.
Thank you.
Can we have a brief introduction of yours?
Thank you for having me here. I'm Arun, founder of Janitri. We are a Bangalore-based company focusing on pregnancy, labor and newborn monitoring and early decision making based on the wearable and AI-enabled solutions. Our whole focus definitely, ultimately, end vision is to reduce maternal mortality rate and infant mortality rate by providing wearable and AI-enabled solutions to both hospital and home setting. So these vitals can be monitored at the right time and early decision making can happen at the right time. So yeah, it's been 8 years of our journey, a lot of R&D, and we are now we are in more than 600 plus hospitals now, more than 1.5 lakhs mothers have been monitored so far. More than 8,000 mothers have been impacted in terms of saving life.
So just to begin with, can you just give a brief introduction of Janitri? What's the mission, vision, agenda, and the futuristic view of it?
So Janitri itself, if you see, it's a Sanskrit word of mother. So our whole vision is like we're working with a vision to see a world where no mother or baby die during pregnancy, labor and newborn. And before I started Janitri, I myself have traveled down to 100 plus hospitals across the country, sat down with each and every stakeholder of gynecologist, pediatrician, neonatologist, staff nurse, ASHA worker, A&M, pregnant women, their family, babies and all, and try to understand like why in this 21st century there is still a mortalities and morbidities, right? And then went deeper into it, tried to understand those problems, and we figured out one challenge is still those critical vitals are not getting monitored, and based on that monitoring, those decisions are not happening at the right time. So I mean, there are a lot of mortalities and morbidities are preventable if this can be done at the right time. So that is what we are doing.
So great to hear that. As you just mentioned about the maternal mortality and the infant mortality rate, so just would like to have a gist of what is your perception in terms of the difference of the internal infant mortality rate and the maternal mortality rate between the urban and the rural sector.
So if you look at India itself as of now is in the range of around 97 over 100,000 live birth as a maternal mortality rate and around 29-30 infant mortality rate out of 1,000 live birth. But this is across the country, but these numbers are also segregated the state-wise, because if you see, there are a lot of states which have done a great progress, but there are still a lot of states which have not really done a great progress, right? And that is how it is also divided into urban versus rural. Unfortunately, there are a lot of C-section is happening at the urban setup to prevent any kind of a complication, mortalities and morbidities, and hence there's a lot, and that facility is not there in the rural area, hence a lot of mortalities are taking place in that particular. So hence that ratio is higher in the rural sector definitely in comparison to the urban.
So what strategies and the potential agenda the government is having to integrate sustainable ecosystem in the rural sector?
So there are a lot of programs coming, and ultimately if you look at what is the challenge here, we do almost 3 crore birth per year, right, in a year in India, and only 50,000 gynecologists. So look at that mismatch. So it's ultimately staff nurses, A&Ms and all who needs to take care of all of these services during pregnancy, labor, newborn and all. So they need to be well equipped enough in terms of their knowledge, in terms of their technology and all. So they can give the mothers or expectant mother to a best service. And that is where I think the program is also taking place. Government is also understanding the need of tech, because here the tech can only solve that gap, not really the manpower. You cannot really bring a lot of manpower immediately, but you can bring tech. And that is where a lot of these Pradhan Mantri Mission Yojana, and where a lot of tech involved, even our deployment of the product during the antenatal phase, labor phase, postpartum phase, where the tech is monitoring something or tech is doing something and giving some kind of an outcome to a healthcare professional, so they are taking the decision on the right time. So that is something I think government is also including the tech in the policy, and that is where our medical sector is also growing in India. It's because of these medical devices policies also in place.
So it was great having you over here in the podcast session. Great insights, great knowledge shared over here. So it was a pleasure to have you, Arun,
Thank you.
with us today. Thank you so much.
Thank you. Thank you.